sparkling teeth promotes confident smile. But what if you lose your tooth? After tooth extraction, blood will fill the socket, forming clot. This is gradually covered by gum as healing progresses. Looking closely into the socket, blood clot gradually turns into granulation tissue and eventually to bone. Unfortunately, during this healing period, bone loses its height and width and will thin over time. Good news is socket preservation immediately after extraction with Alvelac can prevent this loss. Alvelac helps stop bone loss and is easy to use. First, measure socket size. Then, select and insert right-sized Alvelac into socket firmly, engaging buccal and lingual walls. Placement can be horizontal, vertical or diagonal at crest level. Finally, suture and place wet gauze. How Alvelac works? It's a rigid yet highly porous bioscaffold, preventing collapse of socket walls. It also holds blood clot to crest level and maintains maximum space for bone formation. As bone forms naturally, bioscaffold will dissolve away. This way, height and width is preserved with good foundation for future tooth restoration. In comparison, without preservation, thinned bone and sunken gum will form. But with Alvelac socket preservation, contour will be well maintained. A denture will have poor aesthetic and uneven fit on a sunken gum. But with Alvelac socket preservation, it's well fitted. Sunken gum causes a prominent black line below the bridge, giving poor aesthetic. With preserved bone, there will be no black line. Thinned bone compromises implant success due to exposed implant threads and poor stability. A good preserved socket assures high success. Thus, for functionality and aesthetic, out comes a tooth, in goes an Alvelac. Alvelac socket preservation, the natural way.